Hi, I'm Garvin. This video is on Toujeo. So what is Toujeo? Toujeo, or insulin glargine, is a man-made form of a hormone that is produced in the body. Insulin is a hormone that works by lowering levels of glucose or sugar in the blood. Insulin glargine is a long-acting insulin that starts to work several hours after injection and keeps working evenly for 24 hours. The Toujeo Solostar injection pen is used to improve blood sugar control in adults with diabetes mellitus. Toujeo is used to treat type 1 diabetes or type 2 diabetes in adults. It is not known if Toujeo is safe and effective in children. So some important information about Toujeo. Toujeo Solostar contains 3 times as much insulin per milliliter as regular insulin. So how should you use Toujeo? Well, first of all, you use Toujeo exactly as prescribed by your doctor. Follow all directions on your prescription label. Do not use this medicine in larger or smaller amounts or for longer than recommended. The Toujeo brand of insulin glargine contains 3 times as much insulin per milliliter as regular insulin. Insulin is injected under the skin. You will be shown how to use the injections by your diabetes doctor or nurse. Toujeo must not be given with an insulin pump or mixed with other insulins. Do not inject insulin glargine into a vein or a muscle. Toujeo is usually injected once per day at the same time each day. Use a different place each time you give an injection. Do not inject into the same place 2 times in a row. Use only the Solostar injection pen that comes with the Toujeo. Attach a new needle before each use. Do not transfer the insulin from the Solostar pen into a syringe. And you never share an injection pen with another person, even if the needle has been changed. Sharing these devices can allow infections or diseases to pass from one person to another. Use a disposable needle only once. And low blood sugar hypoglycemia can happen to everyone who has diabetes. Symptoms include headache, hunger, sweating, irritability, dizziness, nausea, fast heart rate, and feeling anxious or shaky. To quickly treat low blood sugar, always keep a fast-acting source of sugar with you, such as fruit juice, chocolate, raisins, or non-diet soft drink. Your doctor can prescribe a glucagon emergency injection kit to use in case you have severe hypoglycemia and cannot eat or drink. Be sure your family and close friends know how to give you this injection in case of an emergency. Also watch for signs of high blood sugar or hyperglycemia, such as increased thirst or urination, blurred vision, headache, and tiredness. Blood sugar levels can be affected by stress, illness, surgery, exercise, alcohol use, or skipping meals. Ask your doctor before changing your insulin dose or schedule. Toujeo is only part of a treatment program that may also include diet, exercise and weight control, blood sugar testing and special medical care. Follow your doctor's instructions very carefully. Keep this medicine in its original container, protected from heat and light. So storing unopened Toujeo Solostar pens, you will refrigerate and use until the expiration date. Storing opened or in use Toujeo Solostar pens, you store the injection pen at room temperature, do not refrigerate, and use it in 42 days. Do not store a Toujeo Solostar injection pen with the needle attached. So what happens if you miss a dose? So call your doctor for instructions if you miss a dose of Toujeo. You should not use more than 1 dose in a 24-hour period unless your doctor tells you otherwise. Keep insulin on hand at all times and get your prescription refilled before you run out of medicine completely. So what happens if you overdose? Seek emergency medical attention. Insulin overdose can cause life-threatening hypoglycemia. The symptoms include drowsiness, confusion, blurred vision, numbness or tingling in the mouth, trouble speaking, muscle weakness, clumsy or jerky movements, seizure or loss of consciousness. So what should I avoid while using Toujeo? Do not change the brand of insulin glargine that you're using without first talking to your doctor or pharmacist. You avoid medication errors by always checking the medicine label excuse me, before injecting your insulin. Avoid drinking alcohol. Excuse me. Avoid drinking alcohol. It can cause low blood sugar and may interfere with your diabetes treatment. Toujeo side effects. You get emergency medical help if you have signs of an allergic reaction to Toujeo, redness or swelling where an injection was given, itchy skin rash over the entire body, trouble breathing, fast heartbeats, feeling like you might pass out, or swelling in your tongue or throat. Call your doctor at once if you have fluid retention, which is weight gain, swelling in your hands or feet, feeling short of breath, or low potassium, which would be leg cramps, constipation, irregular heartbeats, fluttering in your chest, increased thirst or urination, numbness or tingling, muscle weakness or limp feeling. Common Toujeo side effects may include low blood sugar, itchiness, mild skin rash, or thickening or hollowing of the skin where injected the medicine. So what other drugs will affect Toujeo? Many other medicines can affect your blood sugar, and some medicines can increase or decrease the effects of insulin. Some drugs can also cause you to have fewer symptoms of hypoglycemia, making it harder to tell when your blood sugar is low. Tell each of your healthcare providers about all medicines you use now and any medicine you start or stop using. This includes prescriptions and over-the-counter medicines, vitamins and herbal products. So the side effects, along with its needed effects, insulin glargine, the active ingredient in Toujeo, may cause some unwanted side effects. Although not all of the side effects may occur, if they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur while taking insulin glargine: anxiety, behaviour change similar to being drunk, blurred vision, chills, cold sweats, confusion, convulsions, cool pale skin, difficulty with thinking, dizziness or lightheadedness, drowsiness, excessive hunger, fast heartbeat, headache, nausea, nervousness, nightmares, restless sleep, shakiness, slurred speech, tingling in the hands, feet and lips or tongue, unusual tiredness or weakness, and less common or very rare would be fast pulse, skin rash or itching all over the entire body, sweating, trouble breathing. Some side effects of insulin glargine may occur that usually do not need medical attention. These side effects may go away during treatment as your body adjusts to the medicine. So if you have any questions, you can contact me through the Life Pharmacist on the website, or email me or call in to Lynch's Pharmacy in Broaddale, up near Ibrahill and Douglas. Thank you for watching.